So good afternoon, everyone. You are so welcome to our Habitat Ethiopia update from the field. I'm so blessed to be able to welcome Dereje Adugna, who is Habitat Ethiopia's National Director and who has only been with Habitat for a short period, but his background and experience is in development, and we're delighted to have him both in Ethiopia but also joining us in Ireland today. As most of you know, our partnership with Habitat Ethiopia has transformed the future for many people, many vulnerable people in Ethiopia since 2005, since the first team from University of Ulster travelled, and we're thankful for the partnership with the University of Ulster and for all that meant for people here in Ireland and also in Ethiopia. So I'm delighted to welcome Dereje. It's been my pleasure to get to know him only a little and only by Zoom in this last few months. But one of the things that I feel about our current position and not being able to travel is that all of us, whether we are only around the corner or on the other side of the world, is that we are able to connect in a really powerful way through technology. So Dereje, we're delighted to have you and welcome, and we'll hand over to you. Thank you so much.
Thank you very much, Jenny, and good afternoon, everyone. And as Jenny has briefly indicated, I've been almost 7 months now with Habitat for Humanity Ethiopia. But the 7 months for me has been a very rewarding months because I came when the COVID started. And I have also come across quite a lot of difficult moments in Ethiopia, the civil unrest and all these things. So what enjoyable it is to support the people we're supporting in this difficult time. And for your information, Habitat for Humanity Ethiopia, we haven't even closed our office during this COVID pandemic period because we felt that it's very difficult to stay home while we're leaving the people behind who are actually in desperate need of shelter in this difficult moment. So I'm very much humbled to share you some of our experience from the field. And I think I'd like to move to the next. You can see on the picture the two smiley faces. It's as a result of the shelter, because shelter is always a hope for the family. And let me move to the next slide. I think, as you know, Ethiopia has got just a very brief background in terms of the context. The population has almost reached 109 million. We are second in Africa in terms of population, and the growth rate is almost 2.5% per annum. And 46% of the GDP is coming from agriculture. And we have got almost 85% of total employment, which is the rural population in general in agriculture. And almost 20% of the people is living in urban areas. And the urban we're talking, even though it's called urban, but it's totally slum and shanty areas who doesn't have a basic services. I think almost 20% of the population, they live below $2. I think according to UNICEF study, which is a recent one, 70% of housing units requires total replacement because it doesn't, it's not habitable in various forms. And Addis Ababa, the capital city, 80% is a slum. And, you know, behind every big high-rise building in Addis Ababa, you will see all those slum areas. But when you go into it also, it's actually very, very, very destitute kind of life. And 40 million people have only water supply gap. And again, around 20% have also access to improved sanitation. And 70% of people practice hygiene behavior And you can see the gap, and there is quite communicable disease which is attributed to this water and sanitation and hygiene services, more than like 60 to 80%. And drought and flood and internal displacement is becoming a phenomenon that's happening every time. So I think low income and vulnerable families live in substandard houses without access to basic services. And I think Habitat for Humanity Ethiopia has been for almost 27 years now in Ethiopia. And we are mainly working with vulnerable low-income families. That includes disabled population, people who has no income at all, people affected by leprosy, and elders. These are our main targets that we are working. And we have got a program what's called the Integrated Urban Slum Upgrading, which is in Addis Ababa, which is mainly, to cities to have a sustainable and build a resilient community, which is in relation to SDG 11. And we do have this regional vulnerable group housing, which is outside Addis Ababa, and the water and sanitation and hygiene program, again, linked to SDG 11. And we have this disaster risk reduction and response program. That's what we call it DR3, and wash resilience building, mainly to ensure access to water and sanitation for all. And we do have emergency response to some of our outbreaks. Cholera is a very common phenomenon in most of these slum areas, congested places. And also COVID-19, as you know, is another big disaster in this year, which is actually significantly affected huge number of people. And I think, as you can see, some of this wash is actually building strengths and creating stability and self-reliance. This is near their houses. They have this, what we call it, water distribution points, where families are actually easily enjoying. And I think our program strategy focuses, we're trying to create healthy living environments through decent housing, improved sanitation facilities. And we are actually improving access to sustainable and safe and improved source of water in drought-prone areas. Ethiopia has got almost 420 districts, which is a drought-prone area. And out of that 400 plus drought-prone areas, 190 of them are severely affected places, and we are working in one of these areas. And especially the wash, people are, traveling around 30 kilometers to fetch water, but at the end they are fetching dirty water. It's not even potable. So we have to transport using pipes from the source to the nearby distribution points. That's where we are trying to improve a lot. And improving hygiene and sanitation knowledge and practice of target communities in a places where water source is very scarce and difficult. We're still using water purifying tablets, which is actually helping a lot, especially in controlling the disease for children and mothers, who is so usually also victims of such kind of things. And we're trying also, whatever infrastructure we're building, there should be a proper governance for sustainable use. That's what we are focusing our programs. And I think so far we have served more than 121,000 families through housing, wash, and this DR3 program. I think COVID, as you all know, has been a very difficult situation, which has gone beyond the control of everybody. And the same is true with Ethiopia. The first case was found in mid-March, and then government has declared a state of emergency. We just came out by end of August. And there is also quite a lot of health education and diagnosis which was happening. And then like some of the PPs like face mask became a mandatory by end of May, and then quarantine testing and all these things has happened. And as medias and professionals also started creating awareness. The challenge and impact that what we have seen in our work area, the COVID-19, the biggest thing is the social and psychological impact. People felt very panicked within a short period of time because they've been locked, they couldn't be able to move, and everything has gone into a different direction, which nobody expected, and everybody gets shocked. So it has created a lot of stress and quite a lot of psychological impact. There was also the social fabric started breaking down. People start supporting each other, and it has impacted on the health of the people. And there was significant lack of resources to protect the pandemic, particularly in those places where we're working in poor households. And everybody become uncertain about the future because the pandemic, nobody cannot predict and tell you when it's going to stop. And the whole lack of coordination within the globe also, and among the neighbor countries and all these things also was an added factor which makes everybody get panicked. And I think there was a big economic impact. As you know, in Ethiopia, people are working today for consuming today. They don't save, they don't get any extra money because their income might not be more than $2 per day. And I think and also families who live in poverty house are severely impacted. The micro business and some service and labor, people started not to believe each other, trust each other. And then whoever is doing petty trading, nobody is buying them. And unemployment has also increased because the big businesses has actually locked down, and that created a big unemployment. And the job security and business becoming uncertain. So the pandemic impacted the economic and psychosocial aspects of communities in general. So as Habitat for Humanity Ethiopia, what we have done, what was the effort? You know, the economy, the psychosocial aspects of the community has been affected. So as Habitat, we have taken measures to protect. The first thing is our staff, because we are the frontliner to actually reach to those people. But at the same time, we came up with a clear strategy how to support in this difficult time for the people. And we established our own task force, and then we started implementing quite a number of COVID-19 emergency response projects. We started in Addis Ababa. We extended in a place called Legatraf or Legadadi, which is an IDP settlement. These are IDPs, internally displaced people, as a result of the civil unrest that has happened in June, July. And then we started providing wash kits and food for more than 1,000 vulnerable and internally displaced people. As you see on the right side, the picture on the top, that is the way we have arranged for people to come and receive their ration, which is meant for 3 months. It includes like oil and wheat flour and some hand washing soap liquids, some masks and all these things. And as you see on the below down, you can see that soap bar, which is blue color, which is a very detergent soap bar, and the rest are part of the material that was given. And I think so far we have got 68,000 total cases, and still we have got active case who has not been recovered, almost 39,000, which is a big number for a small country. And this is out of 1.1 million testing, by the way. If the test increase, this number would be significant. There are a number of cases which has not been reported. And I think still this figure has got quite a number of doubts in it. I think Habitat for Humanity, we're working with government. Government both at region, local, community level, because they are especially the community level, we call them champions. Retired teachers, retired health worker, people who has got respect in the community are very, very important in this time, and we're working with them. And we work with the families, community leaders, and then we have also what we call WASH committee. These are a committee who is taking care of the whole water facilities. And I think the local volunteers, as I've said, we call them champions. We are actually giving them very nominal costs to cover their lunch during the day when they are working. They are not salaried. So I think they were very helpful in this COVID response in general. I think, as you see, our partnership with Habitat in Ireland has been for a long time. And these are some of our friends who has been in Ethiopia, who came actually to build this house. And we're really missing them quite a lot. It's unfortunate, the pandemic is actually creating a barrier. We are hoping, things will go away very soon, and we're just coming across because we have a lot of need for those kind of support. And I think between Habitat Ethiopia and Habitat North Ireland, it has started quite a long time, in 2005. And I think we have been supported a lot in constructing houses in many places, Dereje, which is northern part of Addis Ababa, Debre Birhan, the same, in the same direction, Kombolcha and Bahar Dar, and some other towns, And it has also, that partnership created a greater opportunity for vulnerable families to move out of poverty. I'm a very recent incoming person into this organization, and I can be a very good testimony any time now, because I have seen the change people has got as a result of those houses that has been constructed. There are very touchy stories where people are telling they always saying that, we wish if there are quite a number of other organizations like Habitat, because once you have a house, there is a hope. That's what people are saying. It's a very interesting thing. So a key partnership to start helping families affected by leprosy. As you can see, the photograph on the right side, what it looks before, what it looks after the support. And again, the first project partnership was in 2006, where we have constructed 100 families in need of decent houses. And then it keeps continuing. In 2011, we constructed 92 houses, including 6 communal water points and 200 improved kitchens. And I think following this successful implementation, and Habitat North Ireland and Habitat Ireland have been making significant contribution in achieving the Habitat mission in Ethiopia. And I think total financial contribution in previous year, it has been more than $476,000 US. And I think you can see some of these Habitat built houses with the support of Habitat North Ireland. And you won't believe, I was there 2 weeks ago in this place. The way the economy has boomed, you will not believe. And people, once they get the house, they started doing a number of good things to change their life. And some of them, they don't have limbs. Both limbs are not there. They are disabled. Some of them, they don't even walk. But they are actually making a difference in their life, sending their kids to school and all these things. And it's very unbelievable, because in my 25 years development career, I never have seen a program that has impacted into the target, within a short period of time. So I think the Habitat work is one of the things which I have testified. And again, the volunteers are actually very crucial for the work what we do. And their presence is actually telling our story and giving also others, what it looks like, where they have gone. So Habitat in Ireland have sent more than 36 global village team with more than 430 volunteers. And they have contributed everything, the labor, they working with the family, they share their story, they listen to them, they spread the words. So it's very important, and it's significant per person donation to Habitat for Humanity Ethiopia work. And I think the support from Habitat Ireland helps contribute sustainable development goals SDGs 3, 6, and 11, where it assisted families to lead better life in new homes. I wish if we get a chance, we can come back and see them. You will see what I'm saying. They started leading better life. It is a real fact. And as a long-term partner, we mobilized also volunteers and supporters for Habitat for Humanity Ethiopia work. And we really thank to Habitat in Ireland. Many families have better living conditions. And thank you. And then the future support, what we need is from Habitat in Ireland is essential for Habitat work in Ethiopia to assist families in need of decent house, safe water, and improved sanitation. And we work together focusing on strategic areas, especially in creating healthy living environment through shelter with improved sanitation facilities and improving about the source of water, sustainable source we're talking about, and improving in the hygiene and sanitation, the knowledge and the practice itself, and also supporting in the sustainable governance of these facilities, because it's not one time, but people, they should keep up and they should be working as much as possible. And also the capacity of families and individuals to protect themselves from COVID-19, because nobody knows when COVID-19 will go away from the world. So it requires a bit of attention. And you can see these families who is actually sending their greetings through the photo. And the same, I'm saying thank you very much, because your support has been very immense. And I think I really appreciate in the name of God. It has been very helpful. I have seen it personally. And as a newcomer, I have seen how touchy it is, the work, what you have done. And the work you have done has changed significantly people's life. Thank you very much.
Dereje, I'm a Seganalo. Thank you very much. I just wanted to ask a couple of questions which will allow those who've been listening to type any questions into the Q&A box. I'll allow them to do that, but a couple of questions that have already come in. You mentioned working with the government, and I know that a few years ago there were some challenges around how Habitat was able to be an advocate in the context in Ethiopia. So I'd love you to share a little bit about that and whether advocacy is, how you see advocacy as an important part of our program going forward.
Thank you, Jenny. Thank you for the question. It's very important question. Yes, I think working with the government in humanitarian space has been a very difficult issue in the past. Especially, you know, the current government came almost 2 years ago. Before that, before this current government, the whole policy was not in favor of humanitarian organization. But now things has changed completely, which is actually the government is started listening to humanitarian organization, but also at the same time, our approach as Habitat for Humanity Ethiopia has made us to become also a prominent influencer on the government area. Especially all the work what we're doing currently is we're trying to involve at the lower level and at the higher level. The lower level, the district administrations are actually the forefront when we're doing all the work what we're doing. They are actually included in the design and approval projects, and also appreciating and monitoring and following up the project. And another area is we're trying to put our hand together with other sister kind of organizations, such as, for example, UN Habitat, Save the Children, and UNHCR, UNICEF, all these kind of things. The reason we're doing that is, one, it helps us quite a lot to advocate at the government space. We're trying to actually influence policy making, especially when it comes to land rights, tenure rights, and all these things. So I think this is the approach we're following as we're moving forward. And today I had a meeting with UN Habitat, one of the area we're discussing about how to influence the governments so that they can contribute also to the shelters that we're developing from the small resource there. They need to take lead, they need to participate. So I think there is quite a lot of change and government is also becoming very responsive. Thank you.
Thank you very much, Dereje. One of the questions which has come in is what are the things we can be praying for Habitat Ethiopia over the next few months? So any prayer requests for the next few months?
Yeah, thank you very much. And I really appreciate for that question. And as you know, for us there are quite a lot of challenging situation which is in our face as we're doing the support in shelter and WASH support to the vulnerable group. One is the COVID is a big issue, which would be affecting significantly those congested area. The second one is the country political environment is not moving in the right direction, which can erupt at any time, which might cause us quite a lot of disruption. And at the same time, our staff who are actually the forefront working with the community are equally also, very much frustrated with the COVID-19 transmission and their own safety. So all these things are quite a very challenging situation. Another big area is, the hands that's stretching to shelter and WASH construction has been actually becoming very difficult this time as a result of the COVID impacts in the whole economy in the world. So we'll be challenged a lot with all those situations. So your praying should be, God should be actually giving us a light on those areas and should help us in doing the work what we have started. There are quite a lot of people who have no shelter at all. I have a house after work where I can go, but the people we supporting, they don't have a house even to think about COVID and other things. So I think we need to give them shelter to those people, at least in this difficult time. Because COVID and shelter are very much related. Someone who has got a house, they can lock down themselves and protect themselves. So that is the challenge we're facing, and we really need your praying to keep us in your thoughts every time in your praying. Thank you.
Thank you, Dereje. Another question, just a thank you so much for sharing. Of what aspects of your work do you think will be most affected by the COVID pandemic in the future?
Thank you for that question. Specifically, we are doing a lot of shelter. We're doing through contracting, construction contracts. So, our community mobilization work, our quality verification work would be affected because we are expecting the cases might increase because the country hasn't tested much. So as a result, our staff might not be able to go forward to do the community mobilization. And the other part is the biggest thing which we are going to be affected is the software component, especially training, meeting with the communities, and all these things will be significantly affected. And another area is, which would be affected is we are very much doubting whether some of our donors will keep continuing giving us the money in the middle of this COVID, because they might divert resource, and whatever shelter we started, we may not finish them. So I think those are the challenges we're having. So I think we don't have any second plan where we can fill those gaps if anything happens by the donor, if the donor changes their mind. So I think the resource we're getting also is not meeting the need of the people. So which will be very basic, providing face mask, but people, they need beyond face mask. People, they don't have their income, so they need food and other supports in the house. So those are the areas which will be affected.
Thank you, Dereje. It's lovely as I look at the list of people who've been able to join us to notice that we've got people from not just Ireland, but also from the US. And it was lovely, Dereje, that you chose to share the photo from the Danny Burns legacy build, because that build is the only team that we have managed to send in this year. And Danny Burns was our very special colleague.
Yeah.
And I think it was really fitting that it was the only team that managed to travel in this year. And Danny would have been just delighted to know that his life had an impact in Ethiopia, because it was one of his most favourite builds when he had been able to travel. But volunteers and Dereje have been at the heart of our work. Our relationship with Habitat Ethiopia has been very personal, and we really hope that will continue. There's one further question and then a final question that I was going to ask. So if anybody else who's on the call wishes to ask a question, please do it now. So the other question is actually from one of the team members, from Karen, who you talked about ambassadors, Dereje, and for Global Village volunteers who travel to Ireland, we call them our ambassadors, and Karen is one of those people. So she said, I think when we were there in February, plans for this year were to build many houses. Obviously, besides finishing what was started by the Danny Burns team, and we managed to get the photos of those to share with the team recently. Are you still able to build, is your build plan on schedule? And Karen also says, which I'd like you to hear, Karen says the trip was the highlight of this very crazy year. So thank you.
No, thank you, Karen. You know, at the beginning, as I have indicated, when in mid-March, when the COVID incidents started to be recorded in Ethiopia, I think a number of organizations, especially humanitarian organizations, overreacted and started closing and stopped working and staying in the house. But for Habitat for Humanity Ethiopia, we have decided to remain working because we had a number of started projects that really needs to be finished. Because those people who were waiting for the house, they didn't have any shelter. So I think it was not ethical, you know, to go back and lock down ourselves, but rather than taking a precautionary measure and strengthening our PPE supports to our staff and creating awareness, and then continue doing our work. That's what we have agreed. And, you know, limit our software components, the gathering, the meeting, and all these things that brings community together. But the actual construction, the contractor has to do. We need to verify the quality, and none of our work has been delayed from our side. Unfortunately, you know, house construction, you don't do it alone, but the contractors and others has actually impacted us on a number of areas because they decided by themselves also they don't want to keep continuing. But it was only a few of them. And so far, everything going very well. Even at this time, we have issued a number of contracts for building in quite a number of houses. And we keep continuing. We will not stop until we ensure that those people, especially, getting their house. And I think keep us in your praying so that we get the strength in this difficult time. Yeah. Thank you, Karen.
Thanks, Dereje. And one further question about the SDGs. You mentioned SDG 3, 6, and 11 specifically. But the question is, do Habitat Ethiopia plan to expand the focus to include further goals, for example, SDG 5 or SDG 7?
Yes, definitely. You know, we are in the middle of developing our national office strategy, a 5-year strategy. One of the things what we are looking is including of some of the SDGs. We also, you know, in our program Beyond the Shelter, you know, livelihood is becoming a critical area to consider. So we're looking those areas, and we don't need to do everything by ourselves. There are other organizations who can partner with us. We're already establishing a partnership agreement with a number of known organizations like Save the Children, SNB, a Dutch organization, and UN Habitats, and UNICEF, and UNHCR. So I think we're trying to join our hands together, because the issue what we're dealing is not small, it's a big issue. It's not a Habitat alone can do everything. So I think we are including those goals as we're moving forward. Thank you, Jenny.
Thank you, Dereje. And just one final question to keep us hopeful as we leave you and remember you in our prayers and look at ways that we can continue to support. What keeps you hopeful for the future of Habitat's work in Ethiopia? So what keeps you hopeful?
Can you come again? There was a break.
That's okay. I wanted to just hear from you what keeps you hopeful about Habitat's work in Ethiopia for the future.
Okay. You know, there is quite a lot of things that keeps you very hopeful, because your support and the support we're getting from other countries is not very easy. The experience of Habitat working with poor and very vulnerable householders has been a very immense one. And also we have seen a real impact projects that has made big change in the life of people, frankly speaking. And sometimes I couldn't even imagine, you know, how long I have taken in the village when I go talking to those people, because as you're listening their story, it tells you a lot of things. Everybody has got a story to tell you, as a result of the support what Habitat has done to them. So I think I'm very much hopeful. We are actually making also a lot of changes in terms of how we are approaching, how we bringing our supporters, volunteers, and our fundraisers. So I think we're trying to expand, and also the other thing is we're bringing our hands to join with others, and bringing also the bigger government institute to be part and parcel of the work we're doing, because land is a big issue in Ethiopia. So land belongs, it's in the hands of the government. Bringing them to be part of this work would help us a lot to solve those issues. You know, especially the work what we're doing in Addis Ababa. Outside Addis Ababa, so far everything is good. So I'm hoping there is a lot of change that we are going to bring, and we keep together to make the changes that we are thinking. Thank you very much.
Thank you so much. I'm delighted to share with you that Father Raymond, who, as you know, led that very first team from the University of Ulster way back in 2005. Father Raymond wasn't able to join us today, but Father Raymond and one other, he's managed to conscript someone else, and they started out by having a haircut for Habitat and raising money, and they're going to have their haircut on World Habitat Day on the 5th of October. And that has now changed, because someone said they would give Raymond more money if he would have a shave for shelter. So rather than a haircut for Habitat, he's having a shave for shelter. And Raymond and Fiona, a friend of his up in Portstewart, have already raised more than £6,000, Dereje.
Oh, that's amazing.
So we are thankful for all of your work. We commit to partner with you into the future and to pray for your work. So thank you so very much, and have a wonderful rest of day. And thank you to all of you who've taken time to join. I know that Becca hopefully will also be able to share the recording afterwards. So thanks so much.
Thank you.
Take care all, and God bless.
Thank you very much. Thank you.
Amasaganalo.
Thank you. Have a good day.
And you, Dereje.
Okay, bye.